I would like to present a paper now, which was a cooperation work of the Department of Simulation and Graphics, where also Silvia Saalfeld took part. And the topic was an interactive visualization of cerebral blood flow for arteriovenous malformation embolization. I want to start with the motivation behind this paper. Our paper is about a very specific disease called AVM, or in long form, arteriovenous malformation. And as not everybody of you would be familiar with this disease, here is a short introduction. So on this slide, you can see the main difference between a normal vascular system and a vascular system with an AVM. In both cases, we have the blood-feeding arteries and the draining veins, but in comparison to a normal vascular system, we don't have a capillary system in between the arteries and veins in an AVM. In an AVM, we have the so-called needles, where the arteries are growing directly into the veins. One treatment for this disease is embolization, especially if the AVM is located inside the brain. On this paper or on this page, you can see a rough sketch of an embolization. And if we take a closer look, we can see the main problem we have when we want to embolize AVMs. As you can see, AVMs can have multiple feeders, and multiple feeders means that multiple arteries are providing the AVM with blood. So if we are closing one of these feeders during an embolization, the blood flow for the other feeders changes. And that could lead to an overload of these feeders and the following vessels. And this, of course, could lead to a rupture, which has also fatal consequences, especially if the AVM is inside the brain. So that's the reason why the physician has to think a lot about the order of embolization during the treatment. So for example, here you can see the multiple feeders and he decides about the order. And this order, to summarize, is really important because we want to keep the risk of rupture as low as possible. Okay, this is the reason why the main motivation behind our paper is to improve the treatment planning for AVMs with a staged embolization. Because of that, we take a closer look into the related work part because we find some papers, for example, from Marker et al., who visualized already the blood flow inside an AVM. But if you take a look at the pictures on the right side, you can see that each visualization is done after an embolization. So a staged embolization leads to multiple angiography sessions. But it would be great if you get this information about how the blood flow changes in advance. And therefore, our aim for this paper is to unify these angiography sessions, and we want to achieve this with a simulation of a staged blood embolization. So through this, the physician gets more information about how the blood flow behaves and how it changes during an embolization in advance of an embolization. Okay, we achieved this with a pipeline which consists of 4 steps. The first step is the embolization, which is in our case simulated. The next step is a flow simulation. After that, a data conversion is necessary, and the last step is the visualization. Now we want to take a closer look at each step. The first step was, as I said, the embolization, and this step was done with the usage of the program Blender. And now you can see our patient-specific AVM model. In this case, the artery or the blood-feeding artery is on the left side. Oh, sorry. And the draining veins are on the right bottom, right under the marked nidus. And as you can see, the nidus is quite complex and the corresponding vessels are now distracting our view for the presentation. So for the presentation, I decided to reduce our model to this basic feeder. So again, here the artery, the feeding artery is on the left side, and the nidus would be placed at the right bottom of this model. So as I said, we need to imitate an embolization, and therefore we had to close each subfeeder of this model. You can see here our main feeder divides up to 3 subfeeders, and for each feeder we had to imitate a closure. And as the goal of the embolization is to close all feeders, we have different combinations of closed or not closed feeders, and through that we have 2 to the power of 3 different models. With these models, we get to the next step, the flow simulation. The flow simulation was done with StarCCM Plus, a program from Siemens where you can adjust flow parameters a lot. And through that, we could imitate the blood flow as close to the reality as possible. To get as close to the reality as possible, we had here an expert interview with some fluid mechanics to pick the correct blood pressure and density and so on. And now you can see the result of the StarCCM flow simulation on the left side. Here we generated 8 different flow simulations. This was necessary because we had 8 different models, as I explained before. And with these simulations, we come to the third step, the data conversion. Here we had the problems that our files from StarCCM Plus were binary encoded, and we needed ASCII encoded files. And for the visualization in Unity with the usage of the VFX graph, we also needed vector files. So we had to do a data conversion with ParaView to ASCII encoded file format VTK. And after that, we created a C# script that converted our VTK files with the usage of a Cartesian grid to a vector file. Then we come to the last step. The last step was visualization in Unity with the usage of the VFX graph. We wanted to use the VFX graph because it has a few or some advantages when it comes to the performance and computational effort in particle systems. As you can see now on the left side, we are possible to spawn millions of particles and see them in real time. And now we can come to the results. Here I have a small video where you can see our user interface. At the right top corner, I'm adjusting the model because sometimes it is interesting to see the model, but sometimes it's distracting the view for the flow. Here you can see that I'm able to pick different color scales. For example, now the rainbow color scale, and now I'm switching to the heated body map because different color scales are different intuitive. And now I can embolize the different feeders. I just have the time to embolize 2 feeders now, but I think you get an impression. And I'm also able to navigate around the model and focus on specific parts where a lot of blood flow is happening, and these areas might have a rupture risk. So now I can come to the conclusion. As you saw, I explained a pipeline of how to get from a model of AVMs to a simulated embolization. Here we used 4 different programs and 5 different file formats, and this pipeline wasn't clear in the beginning of the project, and there were a lot of changes in the used file formats, so this is a story on its own. But as you saw, we have different color schemes which the user can pick because each user is familiar to the different color scales and a different kind of flow visualizations. And we are also able to embolize different vessels. For example, on the left, you can see the middle vessel is embolized, and on the right, you can see the bottom vessel is embolized. And now we see how the blood flow changes, and the red area gives us some impression about which areas suffer from a high pressure of velocity. And we also evaluate this in an informal expert interview with a physician. And he added that this visualization or simulation is a nice addition to the current treatment planning. And to come to an end, I want to say something about the future work. Of course, we should add some more AVM models to have a more sufficient evaluation and to add more information, for example, washeal stress, or also virtual reality for treatment training. And then I want to close with my references, and thank you very much for the kind attention.